Good morning. Today we'll be discussing this second chapter, which is cardiac pathology. So, firstly, we'll be discussing ischemic heart disease. Ischemic heart disease is referred to a group of collective syndromes which includes MI, myocardial ischemia, and the differentiating thing which we learned in the previous chapter as well between MI and angina is that angina is a reversible form, whereas MI is irreversible, and angina can lead to myocardial infarction. Now, there are three types of angina: stable angina, unstable angina, and principal angina. Stable angina is that part of angina in which a person does not feel any chest pain while resting. However, whenever he exerts himself or engages himself in any kind of sport, due to which the metabolic needs of the body are elevated and more blood flow is required but to the coronary arteries. Due to atherosclerosis, the body isn't able to meet up the demands and thus he feels chest pain. This is a form of reversible angina and is the least complicated. The typical finding is a ST segment depression, which is shown on the ECG, as well as subendocardial ischemia. Subendocardial ischemia means that the ischemia is only present on the endocardial layer. Now it is relieved by rest or nitroglycerin. What nitroglycerin does is that it acts as a vasodilator and it helps to relax the blood vessels, thus allowing more and more amount of blood to reach the blood vessels. Now, the other type is unstable angina. Unstable angina can happen anytime. It is due to the rupture of a plaque, which leads to thrombosis and incomplete occlusion. Similar to stable angina, it also shows ST segment depression and is relieved by nitroglycerin. The lastly, principal angina is due to coronary artery vasospasm. Now, the EKG shows ST segment elevation unlike the other two forms which we studied above. And the other differentiating factor is that it has transmural ischemia. Transmural ischemia means that all three layers of basically of the blood vessel are affected. Now, if we come to myocardial infarction, MI refers to necrosis. Necrosis is irreversible loss in the architecture of the myocyte. It is due to the rupture of a plaque, which leads to thrombosis and can eventually embolize as well. The clinical features are severe crushing chest pain, which often radiates to the arm as well as to the jaw. Now, you need to know that the infarction mostly involves the left and right ventricles, whereas the atria are spared. Now, the three most common arteries which are affected during myocardial infarction, the number one artery is the left anterior descending artery in about 45% of the cases, followed by right coronary artery, which supplies the posterior septum and the papillary muscles of the heart, which enable the heart to contract properly. And lastly, the left circumflex artery, which supplies the lateral wall of the left ventricle. Now, the lab tests, in recent times, the troponin I has gained much familiarity, and it is the most suitable test because it rises early and stays for a long time. Its levels rise from about 2 to 4 hours after the myocardial infarction, and they remain elevated up to 10 days. Sorry. Now, the second marker is creatine kinase MB. The MB reaches peak level at 24 hours and returns by the end of 3 days, which is about 72 days. Now, the treatment for all three cases, whether it's for angina or MI, is about the same. Aspirin. Aspirin is an anticoagulant and thus limits thrombosis, which is supplemented with oxygen and nitrates. Now, we'll look at the microscopic changes which occur in MI. As the time progresses, the changes become more and more apparent. Initially, the changes are not visible either gross or microscopically. However, the complications can be severe if the MI is not treated. In the earliest phase, the person can progress to cardiogenic shock, which will lead to a massive infarction. After a person is stable, after 4 to 24 hours, there will be mottled appearance over the heart in the gross changes, and in the microscopic changes, there will be coagulative necrosis. The here is the list of all the complications which can arise. There will be arrhythmia, meaning that the atrium and ventricle will not be synchronized with each other, and beating of the heart will not be in complete synchronization in systole and diastole with each other because of the MI. Now, as the days progress, the changes become more and more visible. The color will change from yellow to red. The red color will be due to the presence of the granulation tissue, and lastly, there will be the presence of a scar formation. The scar formation is of a white color, and it represents the fibrosis. Similarly, the red color is due to granulation tissue, and granulation tissue, which we all know, is due to the abundance of collagen and fibroblasts, and capillaries. Now, when we talk about neutrophils and macrophages, we know that neutrophils are always the first responders in any acute infection and which are followed by the macrophages, which are the scavengers of all the dead cells. Similarly, you can just remember these complications of cardiac tamponade and fibrous pericarditis, which can also occur as the days progress. And these are some of the pictures which will help you to gain a better knowledge and grasp the essential overview of the complications which can arise. So now I will be discussing the cases in which a sudden cardiac death can occur. The number one cause is a fatal ventricular arrhythmia, which is also known as a ventricular fibrillation. VFib is the most common cause of 99% of sudden cardiac deaths. Other common causes include cardiomyopathy. Cardiomyopathy is a disease in which there is a structural defect in the heart muscle itself rather than in the vessels or in the blood which supply the heart. Similarly, mitral valve prolapse, in which the mitral valve isn't closed in a normal anatomic shape, rather it goes upward into the atrium. And cocaine abuse. Why? Because cocaine abuse results in extreme sympathetic response and increased elevated heart rate, which leads to tachycardia and can eventually lead to sudden cardiac death. Now we'll be discussing the two main types of congestive heart failure, left-sided and right-sided heart failure. The distinguishing factors are that the right-sided heart failure has primarily systemic symptoms and affects the organs such as the liver, spleen, and produces pitting edema. Pitting edema means that when you place a finger on the leg, there's a pit formed. However, the pit gets removed as soon as you remove the finger. However, this is not the case with left-sided heart failure. The prominent symptoms of left-sided heart failure are basically pulmonary congestion, and the person gets dyspnea. This is because due to pulmonary congestion, the blood is not adequately pumped out of the heart and is not adequately oxygenated. This present of their heart failure cells, which are known as hemosiderin-laden macrophages, and in addition to all this, there is decreased flow to the kidneys. The kidneys release renin and angiotensin II, which further will carry out vasoconstriction and help to retain the water, thus contributing to the edema further. Now, in right-sided heart failure, the classical appearance of the liver is the nutmeg liver. This is characterized in this picture in which you can see the nutmeg liver. There is a lot of congestion. You can see the hyperemic, I mean the reddish portions outside, and there's a dark brown area over here in the center. So in right-sided heart failure, there's congestion, and the hepatosplenomegaly means that both the liver and the spleen have been enlarged grossly. Now we'll be discussing the major congenital effects which happen at birth. There are two types of shunting: left to right shunting and right to left shunting. In right to left shunting, the cyanosis is visible at early birth and thus it is easily recognizable. However, left to right shunting may be diagnosed after a few years after birth since there isn't immediate cyanosis. Why is there cyanosis in right to left shunting? Because the right side of the heart carries deoxygenated blood, and when the deoxygenated blood mixes with oxygenated blood, there is cyanosis present immediately. However, when there's left to right shunting, we know that the left side of the heart is more adequately adapted to hold large amounts of pressure because of the hypertrophy of the left ventricle. Thus, when there is the left to right shunting, all the high pressure of blood goes to the right side, and As the right side of the heart cannot accommodate so much blood, the right side of the heart gets hypertrophied. This leads to the famous Eisenmenger syndrome, which is characterized by right ventricular hypertrophy, polycythemia, and clubbing. Other causes of clubbing include COPD and heart disease. Now, firstly we'll talk about the VSD. Ventricular septal defect is the most common cause of most common type of congenital defect, and it is due to fetal alcohol syndrome. Fetal alcohol syndrome, as we know that during pregnancy, any drug or alcohol which a mother basically intakes or radiation, its exposure can be transmitted to the child, and the child can manifest the disease. Thus, the ventricular septal defect is a type of left to right shunt in which the left side of the heart, blood from the left side of the heart mixes with the right side of the heart. In the normal heart, there are valves which prevent the left and right side of the heart's blood from mixing with each other. Similar now in the case of atrial septal defect, the most common is the ostium secundum, followed by the ostium primum in the case of Down syndrome. This is patent ductus arteriosus. In normal babies or infants, the ductus arteriosus blood vessel closes soon after birth. However, in some children, there is a failure of the ductus arteriosus to close, and as correctly mentioned over here, it is associated with the torch infection, which include rubella. Now, the characteristic it has produces a characteristic machine-like murmur, and it may lead to Eisenmenger syndrome. Now, the treatment is primarily NSAIDs such as indomethacin, which decrease the prostaglandin. Now we come to tetralogy of Fallot. The tetra the name suggests the tetralogy of Fallot has four main things: stenosis of the right ventricular outflow tract. There is there is hypertrophy of the right ventricles, and there is an aorta that overrides the ventricular septal defect. Because there is stenosis of the right ventricle, more and more amount of blood needs to pass through a thin and narrow passage. Thus, there is hypertrophy of the right ventricle. The classical sign of tetralogy of Fallot is a boot-shaped heart on X-ray, and the heart gets dilated a lot. Now, what does transposition of the great vessels mean? Transposition means exchange in order. The pulmonary artery, as we all know, emerges from the right side of the heart, whereas the aorta emerges from the left ventricle. In transposition of the great vessel, the exact order is reversed, and thus it leads to early cyanosis and hypertrophy of the right ventricle. In truncus arteriosus, there is a single large vessel arising from both ventricles instead of the pulmonary artery emerging from the right ventricle and the aorta from the left ventricle. There is a single vessel. In the case of tricuspid, now these are, as you can see, there are many types of congenital defects. Tricuspid atresia simply means that the tricuspid valve fails to form properly. In quercetation of aorta, there is the narrowing of the aorta, and the main symptom by which you can easily recognize that there is quercetation of aorta is that there will be hypertension in the upper extremities, followed by hypotension in the lower extremities and pulselessness in the lower extremities. The classical signs are that there will be a bicuspid aortic valve instead of the tricuspid aortic valve, and the congenital defects which can be associated with quercetation of aorta are the Turner syndrome, which is characterized by XO. Thank you for listening, and we'll be covering the valvular disorders, which include rheumatic fever and infective endocarditis in the next videos. Thank you.